Good morning. Welcome to our Nampa City Council meeting this Saturday morning. It's very different to be doing a city council meeting when I'm by myself in the city council chambers. So, but thank you for joining. So this morning, our city council and our directors are online joining via Zoom, and then our citizens are joining via live stream. So thank you for joining this morning. This morning, we are going to, we have an actual special council meeting because we have a couple of action items, but we're going to begin the council meeting with some discussion. And I've asked Nikki Zog with Southwest District Health and a couple of our directors to provide updates to our citizens and to our council so that we can have an idea of where we are today. But as we get started, typically we begin a council meeting, we open in prayer, and we say the pledge. And, you know, I thought today we're going to just stay consistent with our council meetings, and so I'm going to open in prayer, and I'm going to stand open in prayer, and then I'm going to turn to our flag and do our pledge just like we normally would. and then we're going to go do a roll call, and then we will step into discussion and have a couple of reports. So let's open in prayer. Heavenly Father, we come before you this morning, and I first want to thank you, Lord, that we have the privilege in this country to pray, and that we can open in prayer. Lord, as a city, we rely on your guidance in this community. We rely on you to guide us. As I was thinking about the words in our Pledge of Allegiance that says one nation under God, and I thank you, Lord, that this nation was founded under you as the Lord. So, Lord, we come before you today and we ask for your guidance. Lord, I ask for your protection over our city. Lord, you know we've asked a lot for your wisdom to proceed and to make the right decisions for this community during this historic and difficult time. So, Lord, we need your wisdom, we need your guidance, we need your covering, we need your protection, and we ask for it right now in the name of Jesus. And we thank you, Lord, that you are our God. In Jesus' name, amen. So I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. So as we step into a Zoom meeting, it's going to be a little different, but our city clerk is on, and Deborah Rosen, I'll let you go ahead and take roll call. Now, this is going to be interesting because we're going to have to unmute for roll call. And so, Debbie, as you call the name, we're going to have to pause and let people unmute so that they can answer and say that they're here, but we'll let you go ahead and get started. Thank you.
Rodriguez.
Present.
Bruner.
Here.
Mucci.
Here.
Levi.
Present.
Haverfield.
Here.
And Bauer.
Here.
Thank you. I appreciate that. So let's go ahead and begin. This morning, I've asked Nikki Zog with Southwest District Health if she could provide us with an update. And for those of you that have sent in questions, I forwarded a couple to Nikki to see if she could answer them. And then we will get to questions probably at the end of the updates. So, but let's go ahead and start with Nikki Zog. Good morning, Nikki. Thank you so much for joining us. It's appreciated.
Good morning. Can you hear me okay?
Yes.
Great. So as of late yet last night, we have 22 confirmed cases of COVID-19 in Canyon County. We have 2 reported deaths also in Canyon County. And we have confirmed community split. And what that means is we have, in the course of our investigations, discovered that we aren't able to trace. So,
Nikki,
early on,
you just broke up. Can you repeat that last thing again? Just the very end. Thank you.
sure, thank you. So early on in our investigation is in Canyon County and in our health district, we were pretty easily able to identify where people were exposed to the illness, either through travel or exposure to a confirmed case that we had awareness of. So now we have confirmed community spread, which basically means we don't have the ability to identify through our investigation where people were exposed. So that is, I'd say, an elevated level of concern for our community and something we should all be aware of. And I thought I'd just give some statewide updates as well. So statewide, we have 230 confirmed cases at this point. 4 confirmed deaths. I don't know if that includes the one in Canyon County because that was just reported to us yesterday. So it could be 5, including that one. We have, of the confirmed cases, about 48% of those are 50 or older, and 53% are female. And we believe at least 25 patients of the 230 that we're aware of have been hospitalized. Do you want me to go ahead and answer or address the questions that you emailed me earlier?
Mm-hmm. Yes, let's go ahead and do that. Yes. Yeah.
Okay. So one of your questions was, I'm reading it off my phone here. Have you considered that we have very good data that shows the morbidity rates increasing dramatically among unemployed, so much so that we will far surpass the death rate of this coronavirus? Not sure if that's more of a statement than a question, but I would just maybe respond to that question by saying that certainly those that are employed, and then if they fall into that vulnerable category of people over the age of 60 with chronic conditions as heart disease, lung disease, diabetes, or immunosuppressed, if on top of that they're unemployed, certainly that probably increases or compounds their risk for not necessarily exposure, but potentially poor health outcomes due to exposure. The other question that I got, it's a little bit lengthy, but not too bad, so I'll just read it. It says, my girlfriend works for a division considered essential. She is going to her office every day. The office is somewhat locked, but delivery men and others still seem to come in. I have friends who are engineers and are telling me she should not be there, as heating and cooling systems recycle a lot of air within the building. They do not have filters to clean the air of a virus. If an employee or others with the virus are in the building, it can spread through that system. He said his company is working on high-risk systems to change to only new air. That engineering firm is working from home. How is the city dealing with this issue, having essential jobs? I feel she should not be in the office and allowed to work from home where her environment is more controllable. So this is a person that I wish I could actually have a conversation with to understand a little bit better their situation, but a couple of things that we're doing at Southwest District Health include we don't let anybody in our building at this point without some kind of medical screening. And for people who are, say, picking up like items like lab samples or something like that, or dropping things off, we're trying to limit their entrance and exit from the building and meet them in the parking lots. Clinical services that we provide, like pharmaceuticals and stuff like that, we're just having them do that through like by pick up and carry out. So we meet them out in the parking lot when we know they're coming. And in terms of the HVAC system, most HVAC systems have HEPA filters, which decreases the amount of virus that can circulate through the air. I can't speak to this obviously specific situation and say that they have what they need, but that I would say does help. And the more you disperse the virus, the less likely you are to be exposed to it through an HVAC system. So I'd say that risk is probably pretty low through that mechanism. That being said, I know that the governor and organizations all over the Valley are really encouraging people where they can to work from home to limit travel and exposures. So I'm happy to address any other questions or comments that people have.
So Nikki, I really appreciate it. I learned a lot from what you just shared, and that is that a HEPA filter, as much... Oh, excuse me. So TJ, just a quickie, don't unmute me when I'm talking, thank you. Because I'm going to stay muted the whole time and work through the other systems. So just a quick FYI. So back to the HEPA filters. It sounds like a HEPA filter, while it isn't maybe perfect, that it's good to have a HEPA filter, a high quality HEPA filter, because it's going to help filter the air. The other thing that you said that it sounds like a really good best practice is to meet our delivery people outside rather than allowing them to come inside. Is that what I'm hearing? That is a good idea?
Yes, I think so. You're a little muffled, but I think I caught most of what you said. So most HVAC systems, as long as the filtrations have been maintained, do a pretty good job of, and the HIPAA filters do a pretty good job of cleaning the air. And then, yes, limiting entrance and exit by people that don't need to be in the building, I think is, or I should say maybe entrance, visitors to the building or buildings, I think is important if you can do that as much as you can. And then, of course, looking at alternative work schedules. I know a lot of counties, or not counties, but businesses, governments, and even us at the district are also doing some shift rotation. So they might work a couple days at home and then a couple days in the office to try and limit the number of people in the facility at one time.
Thank you. So, what else, is there anything else that you would like to share with us just to help mitigate fear? One challenge, and then I will say one other thing that I'm hearing from a lot of our questions are people complaining about what is considered an essential service because they say there are so many people out. So that's challenging. And then I'm going to pause a second and say for our Zoom members, it says that they're having a difficult time hearing through the council microphone. And so they're saying maybe I should be working.
They need to turn up their volume.
Turn up your volume is what Mark is saying. So to those that are having a hard time hearing, go ahead and make sure your volume is as high as possible on the Zoom call. So it's kind of challenging because we're trying to stream our Zoom through our main speaker system for the live stream. So we're doing a dual here. So anyway, Nikki, what would you have to say to those that are kind of complaining about our quote essential services, and it seems like everybody's out and about?
Well, that's a really good question, and we are, particularly our call center is getting a lot of the same questions. And what we're trying to do is just answer this the best we can. We didn't draft the order that was supported by the governor and released by the Idaho Department of Health and Welfare. Certainly, essential services and they're defined in the order. There is a lot of maybe one might say flexibility for some things. Particularly around recreational activities. And there was some clarification put out by the governor's office late yesterday. I've sent that to a few people, and we'll get that more widely distributed. It came in pretty late yesterday in the evening. So if people have concerns, I think from a community perspective, the public health district and local municipalities have the ability to take action to address some of those things that they feel like certain orders. The orders aren't either being implemented the way people thought they should be, or they're maybe not restrictive as they think they should be. And if there's still community spread, well, I shouldn't say risk for community spread, I think that's something that puts, all you, the city council, mayor's office, and us as a public health district in a position to have to think about how we might address. And I'll just say, I was going to include this in my update, but didn't have it in my notes, so I forgot till just now. I spent some time speaking with the hospital systems leadership in the Treasure Valley earlier this week. And one thing that came across loud and clear and very consistently was their plea to try to put in any measures that we could from a public health perspective as quickly as possible to slow the spread. They really feel like they need about 3 more weeks to be as prepared as they can be while they're ready now. What tools they don't have that they feel like they need, that they may have and will hopefully start receiving in 3 weeks from now, are things like the personal protective equipment, of course, but another big piece of that is point of care testing, which means that when someone, say, enters the hospital, they're able to test them and get a much prompter result of whether they're infected or not. So that improved testing capability will allow them to better triage patients. And of course, we all know that people who may be visiting the hospitals aren't just going to be COVID-19 patients. They could be people there for other ailments, I guess, injuries and illnesses, and need care. So we want to make sure we're trying to protect those that have to be there that may not be COVID-19. And so just trying to think about how they're going to protect their workforce and their patients and best meet their needs. So I just wanted to share that because I think it's something that as community leaders, we really need to think about how we can help support them in this. They're on the front lines and exposing themselves to a lot of these patients. That's putting them in a pretty hard position.
Nikki, thank you for sharing that. And I don't want to put you on the spot by random questions, but if you don't mind, some questions that I've received. Some parents are really wondering about going back to school. Will the schools actually even resume this year, or will we not resume? And will we really open up in 3 weeks, or what's the likelihood that we'll have to go longer? And I know that I would anticipate that you don't have the answers to those questions today. Can you speak to the decision-making process of what guides those decisions? Is that something that you could maybe share with us? How do we get to those decisions?
Yeah, I can try to speak from my perspective. I do have staff that are working as liaisons with our schools as well, and they are definitely talking now about how reentry might work. I don't foresee schools reopening anytime soon, and I wouldn't be surprised if they don't reopen this year. I don't know that for sure, but I think where at least Idaho is in this pandemic, we're going to see it get worse before it gets better. And so I think it would be unrealistic to think we'll probably have schools reopen even in April, so that wouldn't, leave much time. I think part of your question was about the decision making. So I think we know that children in particular don't have a lot of risk for poor outcomes, but we also know that they're, some might say, disease vectors, right? They are not the most hygienic and are often touching lots of things and doing things that put other people and maybe themselves at risk. So we initially, early on, when schools made the decision to close, I think that was really driven, at least I can speak for my district, on social pressures. There wasn't a lot of public health evidence at that time that it was necessary. At this point, we probably would not recommend reentry, particularly in Canyon County, because we know we have community spread. In our district, we still have counties that don't have any reported cases, but we know we're probably, again, just kind of at the beginning of the situation, and it's likely going to get worse, and I imagine all counties will probably be impacted. So I think the decisions are going to come down to probably just what the environment's looking like for public safety. And when we look at reentry, some of the things we've been talking about and trying to help the schools with is we don't have enough resources within our organization to put a person at every school, but that's what they were asking for, but we just don't have enough people for our 6-county district to do that. So we've talked about training some of the staff to perform basically some medical screening when kids come in, similar to what we're doing at our work site right now. When someone comes in, we're asking them questions about, if they have developed a cough, a fever, shortness of breath, we check their temperature, any exposure to a confirmed case of COVID-19. And I could foresee us implementing something like that, or the schools choosing to implement something like that when they decide to reconvene, because while they may not open this school year, they may choose to open in the fall, and we anticipate we'll still have COVID-19 circulating in our population through probably this time next year.
Wow. Well, thank you for addressing those. Nikki, as we close, is there anything else that you would like to leave everyone with? I think we've got about 150 people listening today. And so I would like to ask if there's any last words of wisdom that you would like to share.
Nothing really amazing, other than I would just maybe reemphasize the importance of people honoring the governor's order to self-isolate to the extent that they can, and or shelter in place, whatever you want to call that. Also, staying home when you're sick, staying away from people who appear to be ill, keeping a 6-foot distance between you and others. Of course, if they have questions, our call center and there's other call centers around the state too, and the hospitals have some call centers that are set up for more clinical questions, but I really encourage people to use those resources. We have, can address a lot of questions and maybe squelch some rumors as well. And I guess just stay safe. We're all going through this together, and it's new territory for everybody, and it's going to be hard for a while.
Nikki, thank you for your leadership. I know that, and it is Dr. Nikki Zog, I'm sorry, I can't believe I just did that, Zog. And I thank you for your leadership with Southwest District Health. Thank you for all you're doing. So,
Thank you.
Thank you. So, we're going to go through. The next person we're going to go to is our fire chief and emergency operations manager, and then we're going to hear from our police chief, communications manager, economic development director, and our director of building department to talk about a number of different things. And then I'm going to wrap the conversation with addressing some questions from the public and some comments regarding myself as mayor and not taking a really strong stance on this. So we'll talk about that as we get through these department updates. But at this time, I'd like to go to our fire chief and emergency operations manager, Kirk Carpenter, who's doing a great job. Kirk?
Good morning, Mayor and Council. Can you hear me okay?
Yes.
All right. And good morning to the community members who are with us live streaming. Hopefully they can hear me as well. For those community members that don't know me, my name is Kirk Carpenter. I'm the fire chief for the Nampa Fire Department, but currently I'm working out of the mayor's office as the interim emergency manager for the city of Nampa. Probably I would start first by just restating what the mayor has stated before, is that we have an amazing team at the city of Nampa, and we're really seeing those connections within this team work for and to the best capabilities of our city and our city's citizens. So, and in the end, whether I as a person or that our community members as a person have the same personal beliefs, what I can say as the interim emergency manager and working on this team is that safety and the well-being of our community members is at the very forefront of the decisions that are being made. And they're being made with a lot of data, information that changes consistently throughout the day. Sometimes within minutes, we are reacting and responding to a significant change. So to handle those changes, we were very proactive early on in standing up an incident management team that operates daily and is responsible to take care of the emergency side of the COVID-19 virus. And we also stood up our emergency operations center that is our main information collection point, as well as our communication flow as we control as much as we can the amount of information that happens on a daily basis. So I would be remiss, and I want to thank the mayor for reminding me to make sure that our community is aware that we wouldn't be where we are today in our emergency response plan if it wasn't for Ed Hewitt, who spent the months prior to this emergency forming and designing our emergency operation plan for the city, literally completing that just weeks before we put it to use for the first time. So we are in debt to him and his works. I will also say that if anybody out there in our community wants endless energy, we would just need to replicate whatever Mayor or Ed eat for breakfast, because they are definitely workhorses and difficult to keep up with sometimes. So following the lead of the governor and our district health partners, we have very high realizations that we are to protect our vulnerable populations, as well as do every effort that we have in our power to stop the surge for our healthcare system. We do know that COVID will be around for some time, and up front right now, our health system needed our help to stop the spread and give us a moment to get ready for this for the long haul. So we are doing our part. We're making those decisions based on protecting those vulnerable populations and doing what we can to stop the surge. Within the standing up of the EOC, we've had a lot of opportunity to learn, and we continue to learn every day. But the biggest thing I guess I would relay to our citizens in Nampa is you be comforted in that your city is working with not just our division heads in the city, and it's not just with one county emergency manager. The valley, the state, even up to the federal government, we are connected. We're communicating. We're actively seeking out opportunity to improve our processes as well as our response to our community. We're continuously developing our community outreach programs and our both emergency as well as just support. And we have really good team members that are doing those acts. The business of the city is still running, and we're learning with technology and an IT department that probably never stops working, because we're learning how to do things different than we've ever done them before. And as Nikki Zog said, this is unprecedented times, and whether you're the mayor or council member or division head in this city, we are writing the playbook for the next 100 years when this thing comes. So for our community, I will just let them know that we're taking it very serious. We are being proactive, and we're doing our very best to make sure that we keep our community safe and running. So I think that's it, Mayor, unless you have something else you have questions for.
I don't at this time, and I just want to say I greatly appreciate the leadership of Kirk Carpenter and our team, our first responders. The best practices that they have been put in place are very important to reducing the spread of coronavirus and the spread internally within our department so we don't get quarantined. And you've done an excellent job, and I appreciate the leadership not only in our community but across the Treasure Valley and the collaboration that's taking place. So thank you.
Yeah, thank you, Mayor. It is nice to have a team within the fire department to where I was able to step into this role, and our fire department continues to run very efficiently. And like you stated, it is a challenge in some days because we're constantly reacting and reorganizing our department to make sure that we have a response, just like I know the police department is, and our public work department is doing the same. And so I appreciate your leadership and the ability to run our departments in a way that might not be the norm, but we're definitely making sure that we stay efficient and ready.
Thank you so much. So I'd like to go now to our Police Chief, Joe Huff. We've had a lot of questions about enforcement and what we're doing with enforcement. And I would like our Chief Joe Huff to share with me what proactive approach he is taking. And then also, Chief, if you could talk about the collaborative discussions that have happened across the Treasure Valley regarding enforcement as a whole.
Okay, sure. Good morning. So I just wanted to, before I get too deep into that, just to let you know, Kirk Carpenter is doing a great job as the fire chief. He is the incident commander for the EOC, and the way that we're staying in contact with him is we've assigned a lieutenant to be the liaison for the police department. The purpose of that is that we're informed. Communication obviously is key, and that we're step in step with Nampa Fire Department and what's going on at the EOC. Just give you a brief update on the police department. I wrote some notes this morning just to let you know all of our employees are doing good. They're healthy. Our call load is very manageable at this point as far as our day-to-day calls. I have been in constant contact with the Treasure Valley, specifically Canyon County police chiefs, the sheriff, Sheriff Donahue. basically the point of the communications several times a week with them is we just want to make sure that we're giving citizens a consistent message related to Governor Little's order. We're getting a lot of phone calls on exactly what is considered an essential business, and like Nikki said earlier, this is new to all of us, and we want to make sure that the interpretations that we're having of the order are the same as Caldwell and Middleton and Ada County. So that's been a lot of discussion just to make sure that we're giving a consistent message out there. Basically, for what we're doing right now is our goal is not to write any tickets or make any arrests related to this order. We're educating the community the best we can. Starting this weekend, we've modified our patrol shifts. The purpose of that is because it'll free up our several people on each team to actually be able to go out and actually educate rather than enforce. We'll have several people. An example would be if a certain business was open, and even if they're considered an essential business, I want to be able to send patrol officers in there just to make sure that they're following the governor's mandate, of the proper amount of people, that they're keeping a proper distance apart and stuff. So again, it's a lot of education at this point. I think I already said it, but I'm happy to say we've made no arrests or no citations related to the governor's order, and that's our goal, is to make it through this whole thing without doing any of that. Clearly, if we need to, we will, but that's definitely not what we're out doing right now. I think it's important that the council knows that we have contingency plans in place if things change. Right now, we've been using our time over these last couple weeks to dust off some of the old plans that we had and to train our people on it to make sure that we're ready to go on the event that we would have to. It's probably not the proper venue or place to talk about what those are, but I can tell you that we're ready to go on the police side of things. Part of the thing that we've really watched for is the health of the employees. That's part of going to different shifts so we can have less exposure inside this building. So far, all the citizens that we've met with or on calls for service, they've understood that we're requesting them to come outside if it's a general report and just to meet us out in the open air. Traffic stops. A lot of times now we've got smarter over the last couple of weeks. We don't actually have to have that document in our hand. We're looking at it as the person's holding it out their window. Minimizing the risk that we have. Basically, in a nutshell, I can assure you that the police department's functioning well. We're staying in good communications with city staff. One thing that the mayor and chief of staff have done is they've ensured that that's continuing on with our city. So, we can be very proud of a city with the leadership that we have here. And I guess I would just open up to questions with any council members or the mayor if you have any other ones.
I don't know if at this time it'll be a little bit hard to go into any questions because of the right now. So we might just address those maybe a little later if we've got them before we close the meeting, if that's okay.
Okay.
Okay, so Victor asked a question, and I'm sorry, I'll go ahead and, I see it coming through in notes. So Victor, the question was, what if a police officer or a fireman is infected, and what plan do we have to replace them? So I know.
You take that?
Yeah, go ahead. That's fine.
Okay. So Councilman Rodriguez, we actually have significant policy plans that we've put in place. It kind of depends on the situation. If we do know that we have the opportunity to quarantine at their house is the most effective way for our first responders to be isolated. Number one, it's more comfortable for them. Number two, it keeps our operations going without having to quarantine the whole station. We've had several instances where we've had to shut down a station and decontaminate, quarantine our members for a period of time until we get negative testing back, whether it's on a patient or one of our team members. But we do have policy in place. We have policy not only when we're going to self-isolate beyond what's being required by the governor, but also how we return back to work. And those are being directed by our medical director and our department physician. as well as the health districts. So we do have a plan in place up to and including which apparatus will be the first ones to brown out if our workforce is getting quarantined enough that we're reduced in our personnel. And then we're working on mutual aid agreements with all the departments around us, not only in receiving assistance, but providing assistance. And as far as I know, other than one of our PD members who, prior to this becoming a problem in our county, as far as we know, we have no members that have currently been infected, and we're continuing to put best practice in place. Our goal is that not one responder is receiving the virus through our care of the community. So we do have a lot of good policies. We also have identified areas where if the member can't go home because the family is quarantined, then we have places where they can stay safe and stay healthy to return to work, as our priority is the service to the community. So
Thank you for that response. It's appreciated. Chief Huff, do you have any further comments before we move on?
No, I don't.
Okay, thank you so much for the report. I appreciate it, and thank you for the update. Thank you both for having policies and best practices in place to protect your people and then to ensure that our first responders also do not share any infection across our community. And so we're absolutely on top of what those best practices are, and I appreciate the work that's taking place in that regard. So thank you both. At this time, I'd like to move to our communications manager, Amy Bowman. One of the goals that we have is that we have excellent communication with our public, and many times that's through Facebook and Nextdoor, Instagram, and then whatever the newspapers will pick up. We've sent out a lot of press releases. We can't guarantee it gets television or paper coverage, but we've got a great partnership, and I will say that the Idaho Press is doing an excellent job, and the Statesman. But Idaho Press is our local hometown paper, and greatly appreciate the partnerships there in helping keep our citizens informed. So, Amy.
Good morning, Mayor and Council. Good morning. It feels like one long day, right? I think I speak for all PIOs and probably a lot of staff that can say this. It's like a baseball analogy. We're getting a lot of baseballs thrown us at once, and so we're doing our best to communicate that information out to the public as quickly as we can. And so what we've done is we've set up some main channels where we're putting our information, and then we've also established channels for the community to communicate with us directly. And so how we're communicating primarily right now with the public is through our website, through press releases, through Nextdoor and Facebook. We also, as time allows, will add to Twitter and Instagram. We've created 2 videos from the mayor as a message from the mayor that we have shared with the media. I think some have chosen to share that and some did not, but we haven't held an actual press conference. But that's something that if the mayor deems necessary is absolutely something that we will do in the future, but those videos are on our YouTube. We also communicate with the public through those that have signed up to receive press releases directly to their inbox. They can do that through our website. There's a mayor's newsletter that is sent out, and there's about 2,000 subscribers. The dedicated lines that we have, in addition to reaching out to the mayor's office directly, the lines that we have dedicated for the public right now are Nampa ready at cityofnampa.us. We have a dedicated phone line for those that maybe don't have access to email, 208-565-5132. They can listen to a recorded message in both English and Spanish, and they can leave a message for staff, and we will call you back as soon as possible. We have dedicated website for coronavirus in English and Spanish. We have links to community resources, which is developing and will continue to develop. We're working with the emergency operations team, with businesses, community resources, our faith leaders. We've had weekly Zoom calls, and so we are making a lot of effort to communicate with the public. We're doing our best to respond to questions through Facebook, through all the different kind of spider webs that are really, that's kind of how I think about it, out there right now. There's a lot of different ways that people are communicating. We do ask for patience as we try to respond as quickly as possible, and through the guidance with Mayor, Council, and the Governor.
Amy, thank you so much. We get communication, and we had some communication where we asked for feedback, and we get some communication that says, thank you, you're doing a great job, we appreciate your efforts. We get communication saying, like to me, Mayor, I'm not visible, I don't think you're doing anything. There's, you're hiding behind the governor's, and I'm just being very candid, hiding behind the governor's decisions. And I appreciate hearing all comments, and perception's important. What is the perception of our public? And I will say, as a mayor, I work very closely with the council, and we made a decision that the decisions we made were going to be collaborative decisions. And it isn't that I'm trying to hide behind anything. It's that I believe that in the abundance of counsel, there's wisdom. And with that, we want to make wise decisions for our community. This is a historic time in our community. We've not walked through a pandemic, most of us, in our lifetimes. And it is not easy to make some of the decisions that we're having to make. And the timing to close, my decision and my recommendation and my personal feeling, and then I think the council as a whole, I think we were in agreement. We wanted to follow, one, the science and the facts, and we wanted to respect the authority of our health districts that are the ones that are guiding us, and then the governor's office and our director of health and welfare, as they have the most up-to-date information. They're in constant contact. And just so the public knows, I've been on the phone every day with the health district, with the mayors across the Treasure Valley. The governor is reaching out to us on a regular basis. There is a tremendous amount of discussion going on. The governor's office is on the phone with the hospitals across the state. I've been on the phone with local hospitals. So we are communicating. We're trying to make wise decisions. Timing is important. And there are some things that are out of our control. For example, the state lab in the testing, they used to only test like conduct 14 tests a day. They moved that up to 20 and then to 100. Currently, they're at about 160 tests a day, plus all of the labs that were the private labs that are now functioning. The process for responses has been slow. It's part of ramping up quickly and we've had to ramp up quickly across the entire nation. When you think about it, trying to get the protective equipment for our hospitals, and as Nikki shared earlier, with our hospitals, we need to ensure that we have the healthcare workers that are available, that they have the protective equipment and the equipment they need to do their jobs. So it is the intent of my intent as mayor, our intent, I think I can represent our city council, the health districts, and the state to do everything we can to protect our citizens and to make wise decisions. There's only so much we can do, though, because the greatest opportunity to impact this resides with every individual in our community. It's for those that think this is not a big deal. I tell you what, if you lost both of your parents, which I know some have, and others that have lost family members across the nation, and then we have our first deaths locally, it is a big deal. But we can mandate, and this is something that I've shared earlier. We live in a county that's very, we're independent and believe in the Constitution, and overall we're a very conservative county, and I love that. With that, though, we need to be careful that we move into a place where we don't respect authority. And the authority at this point is our health districts and those that are giving us good information to make decisions. And so we as individuals have the opportunity to choose if we are going to self-govern so that we don't have to have the heavy hand of governance over us. And let's make wise decisions. let's be careful when we go into a store. And you know what? If a store isn't helping with social distancing, then talk to the management and say, you know what? We may need this service, but we need you to protect us by requiring social distancing, requiring the sanitation measures that are in place. Every individual, every business has the opportunity to make a difference here. So rather than pointing our fingers at each other, how about if we look and see what we're doing? I have to say, I visited with someone early this morning and we kind of laughed because there was a comment about all the people that are out driving around and the long lines here and there. And it's like, you know what? I'm either at my office because I have to be, or I'm at home. I haven't seen that. So the way people are seeing that is because they're one of the ones that are out on the roads. And so how about if we stay home with our families and not go out as much and really restrict ourselves? As we get, well, I'll go ahead and share right now before we move on to the business side and building that we're going to talk about. We closed down the library, we closed down the rec center, we've closed down all public buildings. I even closed down the golf courses this week. The governor said that they could stay open, and the golf courses actually socially distanced. We would, if they were open, there would not be any leasing of golf carts and no one personally connecting in a transaction. However, I closed the golf courses really so that it reminds us all that we are going to all do our part. If all our golf courses were to be open, then there may be people from other communities coming in to golf at our courses. You know what? We do not want to encourage that to happen. We're encouraging people to stay home and do their part. So I think about everything is closed. And the only thing that is open, our parks are open. They're public space. We ask people to self-distance and to be mindful of, the social distancing we need to do. We went ahead and closed the restrooms. Because it's difficult to sanitize those enough. That's a big decision, and we may have to reverse that because we could run into other challenges, not having any restrooms open. I think there are some possibly portable restrooms along walking paths, but even if you were to use one in an emergency, keep in mind it's at your own risk. Wash your hands, do everything that you can to protect yourself and your family. So at that, I'm going to pause, and we're going to move on to the next segment, which is our Economic Development Director, Beth Einig. Beth has been reaching out to our businesses, and I'm going to let her speak, but we are concerned about the economy, our local economy. And we want to do everything we can to help our businesses and actually even now begin on a recovery plan. What can we do to support? In fact, I'll just say right now, Jeff Cornelius, thank you for your comment. He said he'd like to see the city or the mayor declare the next 30 days be Support Your Local Business Month. And so I appreciated that comment. How to do that may be the only problem is it doesn't support the self-quarantine. So, Jeff, I love your comment, but I think there are ways that we can support them. And one is you can buy gift cards online, which infuses cash into a business right now to where we could actually support one another by doing some gift cards and then saving them for Christmas. Anyway, just a thought. But Beth's doing some great stuff. Would you like to share with us?
Sure. Good morning, everyone. I'm going to try and share my screen, and this is my first Zoom sharing screen, so hopefully I don't mess it up. Let's see here. Okay, can you guys see my PowerPoint slide? Looks good? Okay. I won't put it in slideshow mode because I'll probably screw it up. But I wanted to just share with the council and the community some of the outreach that we've been doing really since kind of the March 18th, 19th timeframe is when we really kind of started to recognize that obviously this was going to have a much bigger impact in our community and the need to really start reaching out to our businesses, both large and small. So in the last week plus, I wanted to let you know that we have connected with kind of our largest employers within the community. Those 20 kind of largest manufacturers, including Panattoni, that is the developer for the Amazon project, represent about 5,400 jobs in our community. And I'm really happy to report that in our interactions with those firms, most of them are considered essential through the governor's order, but they've really taken this incident really seriously in the pandemic and their efforts to try to prevent any spread within their facilities. Many of them are screening employees as they come in, like our hospitals are doing. They are making sure that people stay home if they are not feeling well, or if there's any potential exposure. They are working really hard to keep community spread from happening within their doors. So I just wanted to relay how impressed I've been with our employers and what a good job that they are doing in trying to make sure that they are doing their part in processing our food that we need and the essential services that they're providing in terms of manufacturing for the community and our greater region at large. And then we've also had really good collaboration with the NAMPA Chamber. They've created the Facebook group, NAMPA Stronger Than Coronavirus, in an effort to try and kind of reach out to the broader business community. And they've been a tremendous partner with us kind of over these last few weeks in particular. And then we've also been collaborating with the Southwest Manufacturers Alliance. They have put together some great documentation on their COVID-19 website that identifies some of the critical medical supplies that are needed, and are connecting manufacturers with open source documents on how to build a ventilator. And so we've been able to connect some of our manufacturers with that resource that are able to kind of look at what their skill sets are and what equipment they have and how they might be able to meet those medical supply needs. And then through our downtown efforts with Jay Snyder, we've reached out to the 194 downtown businesses, predominantly kind of within the BID district, because we have great access to email accounts and being able to connect with them, and just trying to make sure that we're understanding what their needs are at this time, who's open, who's closed, what the impact is having. And then a couple weeks ago, actually, Robin Sellers was great in our office and put together a COVID-19 website from the economic development page that lists a variety of resources for our business community to be able to have kind of a stop where they can go and get linked to what the SBA is doing, what the Department of Commerce is doing, and our various partners. So that's also available. On the CARES Act, so we've been closely following what the federal government is doing to help support our business community. And as you probably are all aware, this was passed yesterday by the House and signed by the President. And there's a lot of information in this bill. It's an 800-page bill that I've been wading through, but also relying on a lot of resources from our partners to help digest what's in there. There's some great things that I think will be really beneficial for our business community, and then certainly for the city as we hope to have a recovery plan moving forward. But in particular, I wanted to highlight some funding from the Small Business Administration. There's a paycheck protection program that will help businesses cover payroll, insurance, rent, mortgage, and utilities. And this program is being administered through local lenders who work through the SBA 7A program already, which is a majority of all of our banks within NAMPA. And so we're really encouraging our businesses to reach out to their local bankers to get more information on this. But any dollars that are spent in the first 8 weeks of your loan origination may be forgiven. So this is a really important aspect with our business community as we hear, concerns about just doing a regular loan, not sure when you'll be able to make those payments. And this forgivableness is a really important aspect. It also has a delayed payment schedule that's 6 to 12 months. So it's a really interesting program that has been created through this that we're digging more into. There's also the emergency injury disaster loans, and what's expanded upon this is it expands it to individual contractors, sole proprietors, and private nonprofits. And entities that are applying for a broader loan can request $10,000 in an emergency grant at the same time that they put in their loan application. And they have a 3-day turnaround time on releasing that emergency grant. And even if the borrower is not able to be approved for the emergency loan, they do not have to repay this first $10,000 grant. And there's certainly a series of tax credits to help ease the burden for employers that keep staff. And then a lot of expansion on the unemployment insurance. They've created a temporary pandemic unemployment assistance. And this really helps individuals that aren't typically covered by unemployment. So self-employed individuals, independent contractors, and it only requires a 30-day work history of leave. And it also raises the cap on how much unemployment can pay in an effort to try and keep employees full for a 4-month period so that employees aren't losing pay. Typically, unemployment does not necessarily cover all of your wages that are lost from a separation. And then the governor announced yesterday that they will not include COVID-related unemployment against your rating from the state, so it won't impact your unemployment insurance rates moving forward. So we're definitely digging more into what else is in this act. I did forward through Debbie Rosen, our National Association sent out some information earlier this week on the 25th that kind of goes into more detail. It's about 6 pages, and hopefully the council will receive that. So if you're interested in learning more about it, there is more information there that details out these various programs. And then kind of to help connect more with our business community, we will be working with the mayor's office to put together a Zoom meeting for any business in the community that wants to participate on Wednesday at 11:30 in the morning to kind of go over some of these things in the CARES Act. We're hoping to have some good information on the unemployment insurance piece for employers and really trying to kind of create more dialogue with our broader business community to understand what their needs are. And then that kind of next step is really getting that feedback from our business community. We're working to develop kind of a recovery plan through our office. We know that the CARES Act also has an additional $5 billion for CDBG funding. The city is an entitlement community, as you all know. So we'll know within the next 30 days, as required in the legislation, what our allocation will be from that and how we can use it to better support our recovery efforts, both within the business and broader community. So we're back of envelope anticipating that we'll probably receive at least $500,000 through that, but we'll get the definite information through HUD within the next couple of weeks. So we are actually trying to support our business community. We know it's a really hard time when the governor dictates that you have to close down for the good of the broader community. We want to support those efforts, and we want to encourage folks to stay home, but we also want to work with our businesses to understand how we can help them survive this. With that, are there any questions?
I don't know that we have any at this time. Beth, thank you so much. I appreciate your efforts to connect with our businesses and to provide this meeting that's going to take place next Wednesday. I think it's going to be very helpful to all of our businesses. So for those that are watching online, I would like to say, please spread the word. Help us get the word out. I think it's going to be important that our local businesses understand how they can best really walk through this challenging time that they're facing as businesses during this stay-at-home order. So Beth, thank you for your work, and I appreciate what you're doing. Thank you so much.
Problem.
Thank you. So as part of the business side, we've got construction and building questions, and we did have a question come through that was during this COVID-19 stay-at-home. Are you going to continue to release building permits, and will you continue to perform job site inspections? And so the next person that's going to be sharing with us is Patrick Sullivan. He's the director of our building department, and Patrick's going to share with us what the building department is doing right now, because I will say I'm committed to having a safe environment, not spreading the virus, but also trying to keep our economy moving forward. And so we are up and running, but Patrick, would you give us an update? And as we're waiting for those that are live streaming, we're just waiting for Patrick to come on, and the way I'm set up, I can't see Patrick at the moment. You know what, we may have to come back to Patrick, and I would like to have, I'd like to just ask Rick Hogelbohm to please do a reach out to Patrick, and we'll have him back on in just a minute. So we'll come back to that. So I'd like to take this opportunity to actually step into some of the questions that we have received. We ask the citizens to provide a few questions for us. We want to make sure that we are providing the information that you need. So I'll go back to the last question about, are we still releasing building permits and are we still doing inspections? And the answer is yes. The intent is to keep the construction business, which is considered an essential business, moving forward. That said, we are ensuring that our inspectors are working from home, that when they're out, they are to be socially distancing. Some of the projects that we're doing, even Amazon's moving on into some video inspection to keep people, to try to keep things moving forward without also, violating our distancing requirements. There was another question that came through, and I'll have to see, I'm taking these out of order. The question came through about, with everyone staying at home and traffic being light, why don't we do the major changes around Amazon? This would be a perfect time to fix Star and Franklin intersection. And so the good news was that I think it was last weekend, was the weekend that Star and Franklin was shut down. It was actually closed for the weekend because they are doing that work. And so it was nice because the traffic was lower last weekend because it was the beginning of, the stay-at-home order was this week, but it was a lower traffic last weekend. We are continuing to move that forward, and it is great timing while people are staying at home. We're still moving forward with some of our infrastructure work because now is a good time to get it done. So thank you. That was from Kim. So there was a question that came through from a Melody, and she asked about the clarification. She said, it seems like there's been conflicting reports regarding whether or not it's okay to go out and go for a walk or a hike. I understand the Greenbelt is open, but I keep hearing people say you shouldn't drive anywhere. You should only walk where you can walk. And then, so our Greenbelt is open and our parks are open, and there is no driving restriction. What they're the intent with this is to, the stay-at-home order is encouraging people to stay at home and not to be out socializing. We're not, I would love to see my grandkids and all get together, and we're not, because we're trying to continue to socially distance and not gather together. If the only way you can maybe get a bike over to a Greenbelt is to drive over there, then you could drive and then walk. The key is socially distance. Excuse me. I'm sorry, I need to get a drink of water. So I'm going to pause. I'm going to have to pause for a second. I am so sorry. I think right now I'd like to switch over to Rick Hogeboom to give us an internal update, and then I'll come back to questions. I'm sorry, I have a tickle in my throat. I am not sick, just so everybody knows. Anyway, sorry about that. Rick, would you like to, could we move over to you and do our internal staff updates?
Okay, can everyone hear me okay? Is anyone nodding? Can you hear me? I just want to make sure. Okay, very good. And I know Patrick's on, so we'll just reverse the order. Patrick will jump on after me to give an update. So just make this quick to just touch on some major touch points throughout the operations. Of course, a lot of the directors have been working incredibly hard. We've been having 7:30 a.m. daily reports each day this past week, where we've been syncing just the operations internally, and HR, Jamie Chapman's been doing a tremendous job. The ongoing, as Beth just alluded to, the CARES Act, there's other policies that are coming down that affect the workforce and how we make sense of paid leave, expanded FMLA, even the distinction between laying someone off or furloughing them with job attached unemployment. And there's a lot of details there that she's working through. Finance is doing an incredible job tracking expenses tied to the pandemic. There's FEMA forms, Forms 214 and other forms that we're filling out and tracking for potential reimbursement, which is key. IT has been amazing this week. They've done a great job in assuring the work from home accommodations requests that have come in this past week. And just a couple words on the work from home accommodations. We're trying to adhere to the guidelines. So you have in some cases where there's employees who work in cubicles that are close to one another within the 6 feet distance. So
what we've tried to do is follow the social distancing guidelines, and some of the work from home requests are rotations. It's not where they're permanently working from home. They're rotating with their team and staggering days on so that they can accommodate spread where they're not bunched together in cubicles. We also have work from home requests to mitigate risk for certain critical staff who, if they were certainly, we hope no one gets sick through this, but if someone were to get sick and there was a closure, there's guidelines that require really a mandatory quarantine or self-isolation for 14 days. And you can imagine that if someone exposed their entire team and you had an entire critical staff that was down for 2 weeks, it would undermine, jeopardize operations from the city. So we've tried to identify critical staff to work through. And of course, there's the firefighters, police are critical staff. They're on their job. Wastewater. There's a lot of departments where they're on the field and working. And also from the work from home requests that have come in, we've also looked, can they work from home? So the mayor already anticipating the likelihood of some sort of measures coming down, asked department heads to supply us with an analysis. I have a spreadsheet that has hundreds of employees and it explains their work and what % of their work can be conducted at home. And so as we go through the requests, we're assuring that the work from home requests, we're not letting people work from home who aren't working. They're not just sitting at home collecting a paycheck. These are people who can work from home, or they can conduct a percentage of their work from home, and then they come back on site once a week or a couple of days a week to stagger their shifts. So again, these are unique times where we're trying to meet the guidelines for social distancing. Facilities has done a great job. We've heightened the cleaning measures to meet CDC guidelines. They already were meeting CDC guidelines, but the cleaning has happened more frequently. We have closed down most of the public-facing buildings. Police stations open, Family Justice Center, very critical buildings have remained open, but utility buildings, clerk's office, we're not doing passports to limit the hundreds of people who are coming in and transacting documentation right now. And passports, I think, pretty much across the valley are shut down. Utility billing has a drop box and online payment, and I won't go down the whole list, but you get the point that we've thought creatively over the last 2 weeks, how do we meet the level of service as much as possible, maintain it for our taxpayers, and at the same time mitigate risk both to them as well as to our employees. So again, steps have been taken these past 2 weeks to assure that planning building has gone online, and I'll let Patrick speak to that. They can do online processing of stuff. Just a couple quick highlights. We chose as a policy directive to freeze peddlers' licenses for the time being. We were getting concerns from our citizens that they didn't really appreciate people going door to door during this time. Of course, you don't have to open the door for anyone, but if they had a city-issued peddler's license, it gave more the impression that the city was endorsing or supporting them going door to door. And so right now we are not issuing peddler's licenses for the time being because we're not encouraging people going door to door at this time in order to maintain social distancing and mitigate against risk. So that covers everything. The department folks have been doing an amazing job, and even with IT trying to procure work from home arrangements, everyone's been good stewards. We've only procured stuff that's absolutely necessary. Otherwise, they've been good stewards of existing resources, providing access for work from home arrangements and only purchasing what needs to be purchased. And even that's being tracked or was part of, we're just expediting sort of the replacement maintenance policy on some of those devices. So the city's been doing the best job possible to meet most of the essential services. And of course, the rec center being closed, the library being closed, unfortunately, there are certain services that have had to be suspended temporarily as we monitor the situation. But I do want you to know the senior center is still open and delivering meals daily through the drive-through option. And, you know, they're delivering anywhere from 75 to 150 meals through the drive-through, and a lot of the seniors are getting that. So everyone's trying to be creative in maintaining level of service while also mitigating against risk and to meet the guidelines. So that's my report.
Rick, thank you for your update. We did have a councilman that asked a question of, have there been any layoffs? And I will say at the library, because the library, in the beginning that we kept our library workers working to get some work done there, but at this time that there have been layoffs there. And then at the rec center, we have repurposed where we would typically be ramping up our hires for our outdoor parks, which is the mowing the lawns and trying to keep up and the spring work. We've been moving some rec center employees outside to fulfill the outdoor responsibilities rather than laying off and then having to hire others to do the outside. So we're trying to be very fiscally careful. Yet also keep our employees working. We are keeping the services of the city running, and that's extremely important. So anyway, hopefully that answers the question. Rick, thank you for the update. It's appreciated. And so I'm going to come back to the questions in just a minute, but I'm not sure if Patrick's on. I can't tell. And so he is on and ready to go. So Patrick, why don't you give us an update on the building department?
Yeah, on the billing department, obviously our outward-facing counter is closed. We have emails for inspectors, phones for inspectors, and emails for permitting. We have moved everything to electronic submittal, and even for resubmittals of existing permits that are in review. Right now, you can go to the Citizen Access portal that or Citizen Self-Service portal that we currently host, and you can apply for all of the building permits. We are working with planning to turn on all of their applications on that on our website as well, so that they will have a link on their website to apply for any planning and zoning actions. And the time frame for that is likely within the next 1 to 3 weeks. And Tyler is working on that right now. As a workaround, we are also having people just call our either Xander or Juliana, our two main permit techs who are in charge of the online, and we walk people through how to submit. So if anybody has any questions, they can either call our main office number, or they can email our building permit email. So I think it's going to work out just fine, because we already take about 75% of our permit activity online. And we have seen a marked decrease in residential permits being applied for. Corey Barton called us and said they aren't going to pick up anything they have in the queue, which is probably have about 50 to pick up. And they're going to be working on just what they have under construction for the time being and not apply for any more permits. Originally, they were planning on applying for 100 permits a month this year. So that kind of sidelined their plans. Hubble is doing the same thing. We are still getting some trickle-in of some custom home builders. And then we have a couple large projects. We've got a revision to the Audubon project. And then we also have House of Design has come in with a foundation-only permit. And so we'll get that out and as an expedited permit so they can get going on that. We have suspended inspections in homes that are occupied by families. So we're still allowing emergency permits to fix water, sewer, electrical, or HVAC systems. We're just going to defer performing a final inspection on that work until this order is lifted, and then we'll practice social distancing. But we thought it prudent not to risk only our own staff, because we'd hate to take our own staff all the way out and have to quarantine them all if a couple of them got sick. That said, we are going to be shifting to move our inspectors to being based at home. They have all the hardware they need to come into work, grab their inspection vehicle, and then take their iPad and their iPhone out on site and perform all their inspections. So that's one way to social distance. And then we have 3 permit techs who are working from home that their primary duties, 100% of their duties, are working on online residential and mechanical, electrical, and plumbing permits. And they are going to be busy doing that, and they'll have full hours still doing that. So I would say probably our permit activity has gone down, our applications have gone down probably about 30% just in the last week. But they haven't. I'll run another report here over the weekend, and we're gonna monitor just how we're doing volume wise. That said, we have been so busy, and we do have some openings anyway in our department, so it's actually going to allow us to have a little bit more attention to detail and spend a little bit more time on site doing inspections rather than running ourselves ragged as we were prior to this. So I'll stand for any questions.
And Patrick, I don't think we're going to get the questions through this time, but thank you so much for the update. I appreciate it. So, as Patrick has shared what we're doing, we are doing everything we can to, and I've said this before, to socially distance, to protect our community, but also keep our economy moving. I tell you, it's scary to see where our economy could go, and I really want to keep our economy going to the extent that we can. And so we've got good measures in place. And so for the building department, call the numbers you would normally call. And I don't know them off the top of my head, but just we are there, we're still working, and every city department, if you have a question and need to reach out, we are here. Even our clerk's office could answer the phone and answer your questions if you have questions. In the mayor's office, we're still responding to questions. We have our Nampa Ready number, and if you go to our website, I'll have Amy repost it at our website. It is on our Facebook page, our website, and actually I meant repost at the top of our Facebook page. But you can find the number for Nampa Ready, and Amy may be able to come in at the end and remind us of that number that she shared earlier. So I'm going to real quickly, so that, because we've gone on quite a while here, I'm going to go back to a couple of these questions, and so that we can answer our citizen questions. Pickleball, there was a question, are we still playing pickleball? I will say that our tennis courts, our pickleball courts are open. It is a sport that you socially distance. We have not restricted that, just like our parks are still available to go and walk. We just ask that you adhere to the social distancing. Don't pick up somebody else's ball that they've been touching. Just be careful. Mental health. Right now, a concern, as I mentioned, there's concerns over our economy, but also over people's overall mental health, along with the physical health. And getting outside and being able to go for a walk or do pickleball, Facebook Live, or FaceTime, with family members, for those that can. It's important to stay connected. If we totally withdraw and distance to the extent that we isolate, it's very unhealthy from the mental standpoint. So we do want to encourage good mental health and socially distance, don't isolate. So the stay-at-home order, there was a question, did the governor actually sign and do this, or was it the health department? So I believe the health department was the one that ordered the stay-at-home order was done by the health department, but obviously supported and done in conjunction with the governor's office. There was another comment, why don't we put a halt on all construction of any kind? And there's concern over the socially distancing on the job site. So within the order, construction has been considered essential, as was mentioned earlier in this call. With some of the commercial construction, they have really good protocols in place. And I would encourage our businesses and our construction companies to please socially distance. If you're going to be operating, please adhere to and manage. Same way with our hardware stores and those stores that are open. I have heard reports of some stores that are not practicing good social distancing. And that's why our police are going to be around, not to violate, there's concerns over that we're violating constitutional rights. And we are not trying to be heavy-handed, but our police officers, and we have an amazing team that's out there, they're there to help. They're there to say, hey guys, I don't see that you're adhering, and so please, we need you to do that. And so this is community-friendly education and enforcement from a friendly standpoint, just to help everybody be reminded to do the right thing. So I think, just a reminder that there was a comment in here, the Boise Rescue Mission does not receive federal funding and does need support. I'm sure the Salvation Army's right there with that. And I do want to applaud our nonprofits for the amazing job they're doing. In answer to the question about, I started earlier on this one and had to stop. Can I drive to the Deer Flat Wildlife Refuge and walk on the trails there? So regarding the Deer Flat Wildlife Refuge and the information that was there, it's very likely the visitor center probably isn't open. I can't speak directly to it because it uses the word may be closed, but the walking trails are open. So you can go out and walk, just know that the buildings are probably not open, but yes, you could still use the trails. There's another concern over food availability. That people have heard that people are going to multiple stores to find milk, bread, meat, toilet paper, et cetera, and exposing themselves. We had a huge rush on the grocery stores. I'm thinking that's behind us now, and we've gotten back into a normality. I've heard that there is no concern over our national food chain. But when we did have so many going in and rushing in, there was a consolidation. I mean, shelves were bare because people were trying to stock up. My guess is they're stocked up now and hopefully staying home. And there may be mild shortages of something, but there really should not be a concern over shortages of food or anything else in our community at this point. Any slowness is related to trying to be in compliance with safety risks, right, in not spreading a virus. So just know I've not heard that there's any concerns. We have a solid food supply chain in our nation and in our community. There's a very important one here on evictions for those who can't afford to stay in their home or have possibly been evicted or facing eviction. And we had one specific question here. And I want to say, go to the State Attorney General's office regarding this. The governor had talked about making an order that this could not happen. It is going to be coming at the state level unless we as a council, I'm not sure our authority, so I'll have to let legal, when we move into this next portion of our council meeting, I'll let legal let us know what we would have the authority to do locally. Right now, I know the governor is looking into it. I don't know that he's come out with something on this yet, but I would absolutely, if you have concerns, have heard of anyone or you yourself are facing a problem with a potential eviction that would put you on the street right now, please contact the State Attorney General's office and they will help address that with you. And then I'll close with some general statements that came through. While Lake Lola's open and Wilson's Pond, people are saying it's jammed. Socially distance. Again, socially distance. You're outside, there's fresh air outside. We've had a lot of breeze this week. And so it's a good thing to be outside, but socially distance. And so I think that those are local. You're not driving to some other community. It's a local area. People are home. They do have more time. If you can walk and enjoy our Greenbelt and Wilson's Pond or even Lake Lowell, just socially distance. There were some concerns over our drive-throughs in the community and the drive-throughs assuring and ensuring, that they are socially distancing and have good food safety practices in place. And I just want to speak to all of our drive-throughs that have moved to pickup, whether it's coffee or whether it's food to go. Please ensure that you are distancing inside, that your workers are wearing gloves. But I will say gloves can give a false sense of security because if you touch the wrong thing with a glove on, you still have shared the germs. So we just need to be very, very careful and with our employees and what they're doing because they could actually create a spread of a virus here in our local community just because of lack of proper practices in our to-go locations. So please be careful with that. And then another comment that came through was just the education. Wash your hands. Don't directly touch objects that others touch. We all need to do our part. And and then there were some words of encouragement. So I believe I've gone through all of the statements that came through this morning. And at this time, I do want to do one more clarification. Our senior center is providing to-go meals. Other than the to-go, they are closed. They are not open for anything else. They're only open for a drive-through environment to pick up a meal. And so I just wanted to be really clear on that. I want to say thank you to those that are cooking and serving, and I know they're being careful with our seniors. It's a lot of work, and I appreciate the team at our senior center that is continuing to provide meals in a to-go fashion for so many of our seniors. The same is happening, I know the Boys and Girls Club and Melissa Gentry, and I know Jean Munchie has been a part of that. They are feeding hundreds of meals a day and helping support with food, and it's taking a lot of people to do it. There's a lot of work that's taking place. Even in our school resource centers, I know Marie, there are so many people, and if I start saying a couple, I can't say them all, but there are amazing people that are working in our community to ensure that we have our needs met. And lastly, before we move into the agenda side of our meeting to make some decisions, I want to say that we do have our Nampa Ready. It's Nampa Ready at the cityofnampa.us, I believe. And Amy, if I'm wrong, please tell me that. That is available. Look at our website, our Facebook page. We want to hear from you. If there is a need, we will get back to you. If you send an email or call, someone's going to return your call, return your email, and we're going to do the best we can to meet the needs of our citizens. I have been having a weekly call with community leaders to talk about and collaborate on issues in our community to make sure that we're all working together. We have stood up a community team with one of my staff members, Kristen, which is our Nampa Ready community leadership team. We're to ensure that the needs are met in every sector within our community. Matt Davison has set up, he's doing some great work with the businesses, with the Press Tribune, and has set up, there's another Facebook page, and I'm sorry, I can't remember it right now. Amy, I'd like you to come on as soon as I'm done and share those addresses with everyone. There's some great work being done in our community because not one person can do it alone. It takes everyone. We've got to work together, but we have such an amazing community. So I just want to say thank you to everyone for the work and the efforts that are taking place. So at this time, I'm going to go to Amy and have her share those websites very quickly. Then we're going to move in to a couple of action items on our council agenda. But after Amy comes on, if there are community members that don't want to stay for these action items, you're welcome to log off. Actually, I will say one of the action items that we're talking about is actually postponing our public hearings throughout the month of April. I had hoped to keep business going, but with the stay-at-home order, I don't think it's possible with our public hearings to provide the access. So we're going to be talking about that in just a minute. Okay, Amy?
Thank you, Mayor. And I did just post on our Facebook all this information. I pinned it to the top. And so the email is nampaready@cityofnampa.us. The phone number is 208-565-5132. And then I
Say that one more time. Repeat it twice.
The phone number?
Yes.
208-565-5132. And that's a recorded message in English and Spanish. And then you can leave a message as well. And on our Facebook and on our website, on the pin to the top of Facebook and on the main page of our website, which is cityofnampa.us, is a list of all the departments, kind of a quick brief. So if you want to know airport phone number or email, it's right there. So on both Facebook and then I can also put that on Nextdoor as well.
Amy, thank you so much. I appreciate that. So I think we got through all of our external and then internal update. At this time, I'd like to move over to our agenda. We have two action items. The first action item is to consider an extension of the City of Nampa's state of emergency until April 16th. And at this time, I would like Doug Waterman to go ahead and come on and walk us through that. And Doug, if you could do that, if you want to, via screen share.
Can everyone hear me all right?
I believe so. I'm hoping, I will let, if I have a member that's listening to live stream, we'll just trust that this is coming through live stream.
And is everyone now seeing my screen?
Yes.
Okay, awesome. So this first item is pretty simple. It is simply doing what council did back on March 16th, where council concurred and extended the mayor's emergency declaration. That one was into early April, that extension was. However, we now have this order to self-isolate, and so the thought here is to extend the city's emergency until right after that state order to self-isolate expires or is currently scheduled to expire, which will give us time after some action is taken to end or extend the statewide order to self-isolate for the city council to decide whether the state of emergency for the city of Nampa needs to continue or should be extended for some period of time or can end at that time. So the three things that the council would be resolving by adopting this resolution are the extension and then the prompt and general publicity required for extensions of emergency declarations and filing this with the Canyon County Recorder.
Doug, I have a question for you. Is it possible, because I'm thinking, if the state of emergency from the state gets extended or the stay-at-home order is extended, with this, we would have to come back and extend it again. Could we leave it and word it in such a way that our state of emergency would align with the stay-at-home order? Or not? I can see a reason why not, but would you like to speak to that as far as so that we don't have to come back and extend it if needed?
Yeah. I think we could do that. My concern would be this. So this Nampa's state of emergency was declared prior to the state's order to self-isolate. The state's state of emergency was also declared prior to the order to self-isolate. The order to self-isolate is a measure taken by the Department of Health and Welfare in response to the circumstances of the state of emergency, but it is not the state of emergency itself. And so I don't think we want to sort of inadvertently have our state of emergency terminated because one of the measures put in place by the Department of Health and Welfare has been terminated. There are still funding and coordinating functions that the emergency is serving at the county, state, and local levels that we want to continue to have in place. So that was the rationale for putting it at the date it's at right now and not making it synonymous with the state order to self-isolate.
And I agree, that makes perfect sense because that is a specific thing. So my just thought was if we have to come back and redo it, but we'll come back and redo it if we need to. So with that, this is an opportunity for our city council to have discussion around this. And so I think for city council, as you unmute your mics, if I can talk, we're just going to have to see how it works, talking over one another, and then remute your mic when you're done. But is there any discussion from city council on this? And if, yes.
Mr. Randy, I made a motion on the chat, group chat, to approve the motion as indicated with April 16th as being the date that we're extending to as listed. If you'd like to see if there's a second to the motion, I think that would be proper, and then we could have discussion.
And Randy, it's actually...
Darrell seconds it.
Okay, so it's been moved and seconded, but for clarity, this document says that it is, therefore it would be resolved that the state of emergency declared to exist by the mayor's emergency declaration of March 16th, 2020 is hereby extended by the city council so that it will continue until 1 p.m. on April 17th.
Okay, I'll amend my motion to be the date listed on the resolution.
And Darrell, do you?
Mayor?
Yes.
So just the reason that I chose 1 p.m. on the 17th there is the state order expires at 11:59 on the 15th, which means we'll be aware of it on the 16th. There may be something done on the 16th where it's renewed at that point and maybe renewed on the 15th. There's enough time that by 1 p.m. On the 17th, council should have had time to have some thoughts about how to respond to whatever new circumstances there are. So that's the reason for that date and time.
Douglas, thank you very much. I agree with your rationale for choosing that and appreciate it, so thank you. So it's been moved and seconded, and to extend the declaration of emergency until 1 p.m. on April 17th. At this time, it would be the opportunity for any discussion amongst council. Is there any discussion? Okay, so I am seeing no discussion. With that, we'll move to our clerk for a roll call vote.
Rodriguez,
Yes.
Mucci,
Yes.
Levi,
Yes.
Bauer,
Yes.
Bruner,
Yes.
Haverfield.
Yes.
Thank you, Debbie and council. So the next action item on our agenda is to consider suspending all public hearings until the end of the statewide order to self-isolate. I would like to comment that it was my intent to continue to help the work of the city move forward. We did have prior to this order to stay at home, we had a planning and zoning meeting, and we did it via Zoom. We were very, very careful for those that came in with social distancing, et cetera, and it worked very well. That said, once we have the order, the stay at home or stay home order, I feel like it's important that we adhere to that order. And in checking with some other cities, specifically Caldwell, they have suspended their hearings throughout the month of April, their public hearings through April. And I felt like it would be wise for us to go ahead and do the same. So at this time, let's see, I'm not sure if it's Rodney that's going to speak this morning or Norm. I would like to give them an opportunity to visit just a second on this and what their actions have been, and then we would open it up for council. So for a brief staff report.
This is Norm. I believe Rodney was going to give his report on that. The question is what, Mayor, now?
Well, I was just going to have you give a brief update on, or make any comments regarding this, the change, the resolution to suspend public hearings until April 17th. So if you had any comment on that.
Our only comment is that we agree with it, Mayor. We feel like that's in complying with the governor's order to stay at home and limits the risk not only to the city staff and the public that may want to be there that can't participate via Zoom or other ways. Personally, that's really the way it should be done.
Thank you, Norm. And I do see Rodney. Rodney, feel free to unmute and see if you'd like to add any additional comments. Thank you.
Yeah, I think Norm said our perspective there. There was an individual who came to our Planning and Zoning Commission meeting that didn't have access to the internet or to capability to come in through Zoom. And so it would just make it challenging for anybody in that situation to come to a public hearing. So that would be my only comment.
Thank you, Rodney. So in an effort to ensure that any citizen has the opportunity to speak during a public hearing, it is the recommendation of staff, and it's my recommendation that we adopt this resolution, which postpones the public hearings. Now, Doug, I'd like you to speak to, we've chosen the date until April 17th, and I think that is for the reposting of these public hearings. Am I correct with that? That's Doug Waterman.
Here I am. I'm back on. I'm muted. The reason for that date was to make it so that it was approximately synonymous with the end of the governor's order. This one, it makes more sense to have it align with the current projected end of the stay-at-home order, because we were having public hearings during the emergency, and the change in circumstance now is the stay-at-home order. It also has the benefit of aligning approximately with when council would be coming back to talk about potentially extending the city's state of emergency. So a different action or course could be charted at that point if this needed to be extended.
Thank you, Doug. Okay, council, is there any discussion or would there be a motion to approve this resolution?
Mayor Kling?
Yes.
Just to be clear, so we would still have city council meetings via Zoom. We would just not have public hearings?
That is correct. Yep.
Okay, thank you for the clarification. Go ahead.
I'll add, I've drafted it to be that no one will have a hearing at which the public has a statutory, I don't know who's at my door, a statutory right to participate. So that's the distinction. A hearing where maybe there are times when we have allowed the public to participate, but it's not required. We could still have a hearing like that. But anything where a member of the public has the right to participate, those hearings would be the ones that would be postponed.
And we would conduct our next council meeting, which is on April 6th, just the same as we're conducting this one. We'll do staff reports via Zoom, and we'll do it just like we are right here, which is definitely socially distanced and everybody's staying home. Are there any other questions, or is there a motion?
Mayor Kling?
Yes.
Yes, just for the public, we're still running the city by the use of these meetings. They're just closed to the public. And that's what we have to do, is continue running the city based on our financial needs. And that's correct, right?
That is correct. Yes. We're running the city, but we're socially distancing and we're using technology.
Thank you, Mayor.
Okay. Would there be a motion?
Mayor, clarification too. This will still be live streamed to the general public, so that if they do want to listen in on our conversation, our city council meeting, they can still do that, correct?
Mm-hmm. Yes, our future city council meetings will be conducted exactly like we're conducting this one. It will be a combination of live stream, so I'm like looking at the camera right now, live streaming to our citizens, and then we're also using Zoom technology. And I just want to say, Mark, thank you. You're our hero with IT that is setting us up and that's moving us back and forth from Zoom into the live stream. So we have a combination of staff and council on Zoom, and then document share will be done via screen share. And then with Mark here that's doing such a great job, he takes the live stream into the Zoom so that the participants watching via live stream can actually see the documents that we're looking at when we're seeing it. So it's technology is amazing, and but it only happens because there's somebody that makes it happen. And I want to say thank you to Mark with IT and his excellent work. So yes, it would happen exactly like we're doing it today.
Mayor Kling?
Yes.
I'll go ahead and make a motion then to for the council to adopt the resolution postponing all public hearings until mid-April as presented.
Second.
Thank you. So it's been moved by Councilman Haverfield and seconded by Councilman Bauer. Is there any further discussion? Seeing none, I would will stand for roll call.
Rodriguez?
Yes.
Brunner?
Yes.
Mucci? Yes. Levi? Yes. Or?
Who is that?
Haverfield?
Yes.
Did we get them all?
Yes.
Okay. So that concludes our agenda. And I just want to say, I really appreciate the work of our council and the collaboration of our council in our decision-making process and thinking through what to do. Some of the decisions, like closing the golf courses, I will say to the public, I made that decision independent. It was an operational decision. Same with closing the senior center, with the exception of the to-go service. There are certain operational things, and then there are other that are non-operational. I try to stay in good communication, but we have a good team, and I greatly appreciate the work of everyone. I'm thankful, I said this on the last city council meeting, to live in Idaho and to have a community like we have here that is collaborating and working together. And I do strongly encourage us to support one another, and because we are all doing the best we can to make wise decisions with the information that we have. And with that, thank you for socially distancing, listening to the governor's stay-at-home order, and supporting your neighbors. Get out and help your neighbors without exposing them, but you can stay 5 feet away, or 6 feet away, or 10 feet away, and still talk to your neighbor and support them. So I'm just seeing if there's anything else that we need to cover, and I'm not seeing it, so please reach out to our office if you have any questions. And everybody have a wonderful day. And thank you to our staff and city council for joining this meeting. Thank you.
So I'll make a motion to close the public, or to go home, stay home.
I'll second that.
It's been moved and seconded to adjourn the meeting. And Randy, thank you. I almost forgot that. Good for you for being on it. So it's been moved and seconded, and all in favor?
Aye.
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 Thanks, everyone, for great work.
Thank you. Thank you, Jean. Okay, so we're off. We'll stay in touch. Thanks.